Выпуск представляет клиника «Академическая стоматология». Дентальная имплантация любой сложности, реконструктивная и пластическая хирургия лица. Международные стандарты, доступные цены. 8 903 508 0075. professoroрлов.ru.
And here is this. Give me a spatula, please. Could you tell me, do you bite your cheeks? Yes, I do. Have a look here, open wide. First a dentistry, then we can see in the area of this, we can see this pressure, this the molar area. If I press here, so we have a pressure in the, and partly first molar, so we have the bite here. And if I put my fingers, one of the reasons why we're in here, why we gathered together today, can I press in here and you close your mouth and then you open and you say where you bite, where you don't bite. Here. For now, one of the variants. That's what I was talking about, the correct spread of tissue. Of course, this process is not so fast and it's developed. But each situation, it dictates our actions. Now, I would like to, so our task is to lift the tissue backwards and lift it up. This is classic triangle. Have a look. I spread in here and soon the eyes are well seen. I spread down, I didn't touch it. I lift it up and I can see eyes clearly. Have you got eyes plastic? Yes, I had. Now we had. What can I do? I can create a trace in here and put it here. But in order to avoid this pressure, I'm going to introduce the thread vertically. But of course, one of the problems that is created is toss, and the surgeon that was under so have a look here. It's the frontal line. It can be thinner, it can be thicker. Have a look. It can go as a thin line. Somewhere it's more visible. Somebody has it more visible. See how it's preserved. So the world is going to see you. So that's how we need to spread in a fan way that we were talking about earlier. Could you? Now. Relax your face. The first trace, it will be the classical triangle. I'll spread to the back and up. The next trace, we go just the direction of the nose, about 2 centimeters. It will go down and in parallel to our first trace. in the lower jaw. What will I do to get rid of it? I'm going to spread the tissue. Should I get rid of epicanthus? No, because you always had it. So with the age, it grew bigger. So we just need to lift it to the side, but at the same time, do not touch your face. Napkin here and napkin there. So one more time, elaborate my gloves. I said that we are starting from this side. So the injection. So could you please give me the needle 18G? It's over there. 4-conus thread, please. Sometimes 16, 12 conuses is too long, but the price is bigger. If we talk about breast and other areas where the traces are longer, when you go in and out, and it's more complicated, there it's better to use threads with more cornices. If requested, I'll take more. The number of conuses requires the length of the needle. Usually they're all about 30 centimeters, as we were talking during the lecture. So have a look here what we're going to do. I introduce the needle into 5 millimeters into the first trace. As I'm not going to do anything here, I'm not going to apply anything else in here. Here how the threads look like. In each package there are 2 threads. The technique of holding of the thread can differ, but you need to do it the way you're comfortable with. So we make the first injection vertically till this part, then I turn it angle 90 degrees under the fat tissue lay. Do you feel anything? No. And now, any scissors. One moment. And when a patient is lying, so it's easier to do. But in vertical position, you control the process more. It's important to enter into this window. To remember we had a slide. And we make a movement parallel with the skin. And if you pay your attention, So I have just a little bit laying here. That's the level where I am. Does it hurt? No. Then I go to another area. I can help. I can press with my fingers. Okay, there are different techniques. Then I spread the tissues. So have a look at the way the skin responds. Do you remember the pressure we were talking about? Here's the package. I take this package and spread it in order to have a good position. Can you hear this crossed? I just upper it a little bit. So I took the skin, derma, and I lifted it up. After that, I press it towards myself, hold, and now I use my finger and I lift these conuses with my finger and cut off the thread, and that's the lay that created. It should be only if the patient is against, so do not get rid of it. It will go away by itself. The next trace I would like to do is this one, so that I could lift up in parallel with the muscles that hold. So we're going to work with the small muscle. So we have musculus masseter uppering it. We create the trace, the cave for the trace, and it shouldn't be more than 3-4 millimeters. Usually it's this size, 3-4 millimeters. Here, have a look at the needle. This is the line. So here are these cuts on the needle. This is our orienter. So I introduce the needle into 5 millimeters. I turn the needle and follow the trace. I go to the lower side, lower angle. And now my task is to spread the thread carefully. Then the ball. I go into the trace, I introduce the needle into the trace, the same trace, on the level of fat fiber tissue. You can help it. So it's about 5 millimeters, a little bit less. 3.5, yeah. So 3.5 to 5 millimeters. So we got into the vessel. One moment, and we're going to continue. These conuses, how they should be placed? Where should they be formed? You know, you're going to spread. So you take not 4 conuses, but 8 conuses for one trace. 1 or 2 conuses will appear on the superficie, so the more conuses, the better it is. Is it spread along the thread, the conuses? No. I start spreading them from upstairs. And then I start spreading the upper part. Sometimes you operate 10 people and none of them have similar situation as now. So now I spread to the back and to up. Now I'm taking the tissues, scissors. Hold it. If you paid your attention, so here you have a lathe. Of course, after 50 years old, it's harder because we have a problem of the skin. Somewhere we can feel it, this inclination into the fat layer of the skin. But then the spread disappears, it's fine. So the thing is to make sure that the patient doesn't want to spread the tissues another thread. So if patients insist, so I want to make everything smooth. So can we model it? Of course, we can introduce more threads. There are patients who come in 2 weeks, in a month, for additional operations because they do like the result. So the more threads I introduce, the easier for me it's to make the lift and to reduce this toss. During what time can we affect the threads? So it's not so comfortable for a patient to be put into the operation chair during the day, but you can correct during the day. You can correct the threads if the patient agrees. You know, for today's work, I wanted to invite anesthesiologist so that you could see all the problems, all the visual problems, but to work it's not so comfortable in this position. And I do, and I introduce into the same spot. So I was going to invite an anesthesiologist just to make him show how he works. The patient has a fear before the surgery, because after anesthesiology, patient is more relaxed, and it's relaxed. Are you hurt? No. So the criteria is the absence of pain, and from that we can tell that we're doing the work correctly. Now again. Look, I'm spreading the tissue under the angle of 45 degrees up to create this effect of lifting. And of course, I'm spreading them completely. I need to stretch them at 45 degrees. Now if everything is okay, and there is some additional tissue, so you can lift it up a little bit. Now look, I'm creating this lift up in here. Have a look. Is there an effect right now visible? Do you notice the effect? What do you say? Have a look here. Look straight. And this is only the beginning. In 2 weeks, the patient will have another feeling. Do you have the feeling of lifting? Yes, I do. Hands off. Hands off. Yeah. Do you see? And you shouldn't remove it in any case.
Tension of the jawline.
Now we do the job from the other side. Of course, you can put your so you make this decision whether to operate in vertical or horizontal position. But the quality of my Пожалуйста. Куда? Сюда? So take the first trace. We'll make an injection in the spot. Here we introduce a little bit more because there is a spot of connection of several traces. You were saying that there is kind of a tension with your experience of surgery? What do you think? Is it interesting? Could you do that? Could you do that? Right now I cannot give because the models came for me so that I undertake this job. Is there any other thread? Give me another package. I haven't touched the thread. Where is the thread? Here. That is why so you threw away one thread, not the package, but the thread. Okay. Which leaves to you like more. Didn't you charge? Okay, next action. So we detain the first trace. Is it painful with such proportional movements? The diameter of the needle is 18-19 G. So we introduce the needle. To the side. Does it hurt? No. Here is the end of it. Sometimes you can feel it. And it's visible. So with a small tension, the first needle, the first thread need to be introduced in there. So I came in 90 degrees. I have an angle and I inject 5 millimeters and go turn. I have here I have a round trace. Does it hurt? No. Did you have anything in here? Any threads? No, I didn't. So the first trace gives us the possibility to spread this part in here, and then we lift it up. So you do it by yourself. So how the skin reacts better? How are the muscles? So when the patient moved the face, I noticed how her muscles worked. So classically, you lifted the tissue backwards and then upwards. And all this tissue is spread like this now. Now, can you see the movement of my needle? Because I started to go out of this way and I spread it with my finger a little bit further. Okay, we came in. Here we could take the thread of 60 conuses, but it's alright. Dry. See how it is lifted. You can use any instrument, for example, scissors, spread scissors. Can you see my first movement? There was backwards, and here my first movement is to up. Okay. So the next thread. This package is enough for me. So these ends, do not throw them away, because we're going to need them. This trace is going to be lifted approximately at 45 degrees. It should be like that from back. So we start to pull at 45 degrees. We spread it. That's it, enough. Have a look, guys. So we pull it up. I'm not going to cut it off. Why? because I need to create the effect of lifting. I spread conuses along the tissue, but my main movement are these ones. Then I divide musculus digastricus in my mind.
During the lifting, when we put the pincet exactly at the line where you draw, that's where we have the maximum effect on here. Sometimes I use a little bit
да? Ты переводи обратно, чтобы там кто-то понимает, кто-то нет.
Сейчас еще раз туда.
Sometimes when we during a lifting we pull.
Во время лифтинга
We make the applicature of at the end of the platysma. It's exactly at the end of the line that it draws that we have the maximum effect.
вот здесь вот получается в этих линиях максимальный эффект подтягивания. Если мы здесь будем, вот здесь будут точки делать, у нас не будет такого эффекта. Вот здесь максимальный эффект в этих точках. Нам нужно здесь пересечь две линии, и здесь выход будет для максимального эффекта.
Я вхожу, поворачиваю параллельно. Вы должны помнить, что здесь имеются такие основные образования. Это поджелудочная слюнная железа.
So come in here.
Верхний полюс щитовидной железы. Там имеются нервы, веточки большого ушного нерва. Может быть проходить и наружная сонная артерия легкая быть. Потому что иногда анатомическое образование, знаете, всегда
Sometimes it depends. So anatomic creation, if we go very deep, we're going to have problems. So that's why we need to work in our tray or in our lay, and to understand exactly what can we encounter there. So what Nicolas was saying is that we need to take into consideration if I'm not comfortable, I can spread the tissue, and with this tissue in this case, when the patient is lying, it's easier to do it. Okay, so colleagues, now we need to respread everything, and as again Nicolas added well to our conversation, that we need to create the orienters. Sometimes we can stop on nodding muscle, and sometimes we go upper. So that's what gives us maximum effect. If you want to look at this effect, I can show you this. Look, I lift this tissue, gather it, I lift it, hold, and then I lift it till the back position. Where?
Сейчас я заработаю. Значит, и я как раз вот именно в то место.
In the spot, I introduce the needle. So have a look. I leave the trace to backwards
И поднимаю ее примерно, стараюсь покрыть.
and lift it around at about 90 degrees angle.
Не больно я вам сейчас сделал?
Does it hurt? No, it's okay.
Вот оно.
Here.
Теперь.
Now,
Мне же нужно... Здесь у меня нет конусов, но здесь
I don't have conuses in here.
Поэтому я вытягиваю.
That's why I pull the tissue this way and go up.
Quite attached on the sternocleido.
Now,
It's
now
it's quite attached, so the columns hold very well in fact of the tray. And
вот этот вариант лифтинга, он более выгоден, потому что мы всю складку собираем за...
So this variant is very
И,
effective because we have the maximum effect. So the patient is treated well.
в этом участке, конечно,
Everything is fine in this area.
нет конусов, но все равно, видите, я подтянул, я сейчас
See, I pulled it.
эту ниточку.
Now I'm going to cut off this needle. When the tray is finished, we change sides.
Значит, и у вас слезки на глазах, вам больно?
What else? You have tears in your eyes. Are you okay?
Эту складочку.
Yeah.
Сходиться.
Now you can see some plates, but of course they're going to disappear. Tell me, can a dentist do that? Do this job? Oh, one more thing. I forgot to ask my patient the question. Try to open and close your mouth now. How do you feel? I can feel some tension.
Больше не двигайте, пожалуйста.
Don't move your hands, please, because it distracts us a lot. Where there is a cheekbone, there is a tension.
Вы кусаете?
So when you close your mouth, do you bite?
Дайте мне на руку.
Yeah, no.
Уже не прикусывайте.
You no longer bite.
У нас на лекциях
So during our lectures, there are many dentists. Have you heard? Have you seen the problem of our patient? Did we resolve it?
почему бы это
Why not?
не делать?
Why not doing this? And this way helping our patients.
А вы попросите...
Are there any limitations? Can you ask the patient to smile, to become angry? So, does it disturb? No, it's fine.
Дайте. То есть комфортно закрывать рот.
So when you close your mouth comfortably, do you feel any changes? So firstly, you were biting your cheek, but now you no longer have this problem.
Нельзя,
No.
нельзя совершать активное движение.
You cannot make active movement with your muscles.
Нельзя заниматься контактными видами спорта. Нельзя спать на правом, на левом.
You cannot sleep on your right or left side. And during the first 2 weeks, using the cups that we are going to talk about now. What else? So sauna and physical activities, so that should be limited. How much time does it take? Those limitations. So requiringly 2 weeks. No going to the swimming pool for 2 weeks. Yeah. Do you lift your head up? One more time. Guys, you can work when the patient lies and is comfortable, and you should start from this work. As for me, because it's easier, but in vertical position it's better. Change the needle.
Нет, все будет смещено, просто когда пациент у вас находится в положении сидя, он...
When patient is in seated position, so you can see the toes where you're lifting. When we started talking, so the line stopped in here, and I drew this line further to the nodding muscle.
Зачем? Зачем? Давайте видите.
Give me the thread.
Значит, вот как раз когда сидит пациент.
So when the patient is seated, you can correct. Now, Nicola started talking about the nodding muscle, and I showed you how to do that. How to go back to the nodding muscle, because it's one of the variants. It can be like this, it can be like that. There is no mistake in here. But the longer the trace is, and the more cornices you have, the more stable the work is. So first we can make our patient lie down and then make them sit. Oh, it's better to be done seated. Believe me. Well, usually it is done in the lying position, but I taught myself to do it vertically. In small round movements. I introduce the needle, 5 millimeters, approximately. So here I'm going to pull it this way. I've done it. So here I introduce local anesthetic where I end my trace. I shorten it when Nicola made a comment, so I showed you that we can longer the trace. Of course, it's a spread into the tissue. How important is the deepness? It's very important. If it's If it's deep, so the patient will feel the pain. In any case, the patient will tell you that it's painful. So, for example, here I have a node, and it's better to do it while the patient is lying. It's more effective here. Here, look, I make compression and I spread it into tissues, but anyway, I need to make movements to the back to gather the skin and to create this lifting effect. But it's more recommendable to make longer trays, one longer trays. Why? It depends on situation. Of course, it does. See what is rested. 2 threads. Now we'll make a trace that will go in here and we get rid of these wrinkles. Here. Here's trace on trace, and we go from here parallel to the angle of you need to press. If you press along the trace, not down, but up. You go up the trace. How many packages do we have? I've got 5. Have a look. I pull, I stretch on the trace, the thread, sorry. I cut it, and I will work with it too. Then, additionally, we lift. That's it. That's it. Can you see? I lifted her this way. Change. Come from the other side. Here the same. We'll make an injection. Another injection. I can feel it with my fingers. I can feel the trace that is under this one. Local anesthetic. So I lift the tissue. And we can see the end. Micro pincet, anatomic one. Cannot be seen, but the conus is contaminating. Well, in general, we can leave it like this. We'll leave it. So did we stop the plot? Yes. Séjour. What are you feeling? I thank God, I thank everyone. Now, can you see the wrinkles on the face? Show her face to the client. Wow. So how are your impressions? Do you like your face? Girls? Between the brows? Hold on, we are going to do everything. Don't worry. What we are going to do? We're not going to introduce cephalosporin into the muscle, and vein. We'll take lincomycin into the muscle, 2 cubes, 600 milligrams, 4 milligrams of dexamethasone for inflammation, and 3 and robinzin 3 pills. So it's just for to be on the safe side. During the first 2 weeks, for our patient, it is not recommended to walk and sleep without the cap, special cap. We are going to fix Там никого нет. So, you will need to put on this cap and sleep in it. We did an operation now, so it's requireable to use this. Sleep. After operation, to make compression. And that's all. How do you feel? Great. Now, thank you so much.